Ladies and gentlemen, dear distinguished speakers and participants from both Indonesia and Taiwan, as well as some other international students. This is Aaron Chen, Associate Professor from Yuanpei University of Medical Technology, Hsinchu, Taiwan. And I will be the moderator for the first section. And may I have your attention? I would like to announce this is the grand opening of 2021 International Webinar on Global Health and International Collaboration. And first of all, we would like to invite our President to give an opening remarks. And let's welcome Dr. Ji Chen-Lin, President of Yuanpei University of Medical Technology. Thank you. Let's welcome him.
Hello everyone and welcome to today's webinar. My name is Ji Chen-Lin and I am the President at Yuanpei University of Medical Technology in Hsinchu. Yuanpei has signed the MOU with 7 universities in Indonesia in 2021. Due to the pandemic, many collaboration has been temporarily suspended or gone virtually. Today's webinar is one excellent example as how university can collaborate during the pandemic. We believe that there will be more collaboration plans, such as dual degree faculty and student exchange program, study visit in the near future. I sincerely hope that further communication and collaboration among us can be strengthened and establish even lasting relationship. On behalf of Yuanpei, I thank the speakers for joining us and all of the participants everywhere in the world for your shared knowledge and feedback. I wish you enjoy the webinar and have a nice afternoon.
Okay, thank you, Dr. Lin, thank you for your remarks. And ladies and gentlemen, may I have your attention? I would like to remind you for the section 1, we are going to have 2 parts actually. The first part is communicable, while the second part is non-communicable disease prevention. Okay, before we proceed. Okay, for our first keynote speech, we are going to invite Dr. Suyanto, Professor Suyanto. He is from the University of Riau, Indonesia. And today he is going to present COVID-19 pandemic, a global health challenge in current communicable diseases. Let's welcome Dr. Suyanto. This is Aaron Chen, Associate Professor from Yuanpei University. He's from the University of Indonesia. Dr. Suyanto, your microphone is off. Please turn it on. Thank you.
Okay. Okay. Now is or should be. Become bigger? No. Why?
You probably just turned.
Okay. Now in how the screen but I see in. Okay. It's bigger now in the screen, right? Okay. Why? Sorry, I don't have the technical program to make the bigger in the screen. It's already bigger in the in the Zoom, in the Google Meet.
Yes, it's coming
Okay.
out. Don't worry.
Yes. Okay. Yes.
Works perfect.
Okay. Okay. Good. Good day, everyone. Selamat siang semua. Taiwan Penyoman, my name is Suyanto. I'm from Faculty of Medicine, University of Riau. Thank you for inviting me to join in this meeting. My topic is COVID-19 pandemic, a global health challenge in current communicable diseases. This topic about the globalization of disease actually not the current issues. Since 5 centuries ago, when the people travel from the cases of the disease transmission become rapid and more growing during the last century. We other country. Unluckily, the poor and disadvantaged countries are most vulnerable. So, in this case, WHO already set up the international health regulation to make sure every country has responsible to control the disease. However, as we know, during 2000.
Excuse me, Dr. Suyanto.
There is a new diseases, the new coronavirus starting. This is increased. Yes.
Could
Sorry?
Could you share your screen again?
You don't see the picture?
Yeah. Could you do that again? Redo it again. We probably couldn't see it here. Yeah. You just share your screen again.
Screen again. I will put up. I will pause again.
I'll give you more time.
Okay, wait.
Or we can share screen from our side to help you. You just tell us when.
Yeah. Yes. I think it's. Yes. I think it's better because yesterday I think I already familiar with this Google Meet, but not.
Okay, we are going to do it for you. Okay. And when you need to go next slide, let us know. Thank you.
Okay. I think I already did second slide, right? Or we start again from the beginning, or? Okay. Next slide. The next slide, please. Okay. In 2020, we start from here. The disease is already spread from one country to other country, and the cases in the Asia, we see some countries has the better, and another country is become worse. So for me, it's interesting to learn from the Taiwan experience. I think there is one slide before this. Okay. The cases in Taiwan during the beginning of the cases is relatively stable, but in the 2021, in the May, I see there is a little bit peak about the cases from the airline crew. So this is the lesson for other countries. But what we learn is public trust to government and how the country control its border is the key. So we know that Taiwan control the border when the cases starting early, and then they do the testing, quarantine, and the contact tracing using big data analysis. And the most importantly, Taiwan people already having experience from the last event during the SARS. So that's why when the cases starting every people in the country already use the mask and keep the social distance. Next slide, please. This is the cases we see in the 2020. The cases, almost null, almost zero. Even though Taiwan do the testing, but the new cases in the May there is a peak, little bit peak, and then Taiwan can control well. Next slide, please. Next slide. How about Indonesia? In Indonesia, the cases first report on the 3 March. There are 2 cases. Before that, there is no cases, probably because we don't do the testing. But the situation become worse, and now whole the country, we categorize as the red zone or the high density of the cases, except in some district in the western, like in the Papua. Next slide, please. Next slide. This is the situation in Indonesia. We cannot say we have the second wave. Actually, this is still in one wave. But the cases is, we see increase in the 2020 around December, and then we do decreasing, and now we starting higher increase cases due to Delta variant. But this graph actually is anomaly because most of the country is already the plateau, but Indonesia we don't get any plateau line. Next slide, please. Why? Actually, this is important for every student, every researcher to do rewrite, so we can analyze and make the paper, policy, and practice. In the beginning of the pandemic, we from Riau University collaborate with Thailand University, Prince of Songkhla, making a modeling. What the model to control? We starting the model from the April, using the mathematic model. During the mathematic model, we say, guess, the lockdown, or we call Indonesia, is large-scale mobility restriction should be kept through the year. And also we need to increase the mask cover using in the people. But as we know, Indonesia not fully implement that policy. So the cases increase. Next slide, please. Next slide. This is that I write in the paper in the BMC, how we can make modeling about the progression of coronavirus in Indonesia. Next slide, please. So now all of us has a hope with the vaccination. History already tell vaccination is the biggest global health effort in disease eradication. Edward Jenner in the last century already start how to control the smallpox, and now we have enjoyed there is no smallpox. So as Indonesia already starting the vaccination, and all country of the world already make the vaccination, so we welcome if there is study to study about the vaccination and how to get a big effort. Next slide, please. Next slide. So Indonesia now already open the collaboration. Okay, thank you. We hope by this webinar we can develop cooperation, how we can build the coronavirus together. Thank you.
Okay, perfect. Okay, so other than have a question and answer, we are going to proceed to next speakers, and we are going to have Q&A for the last one. Okay, the next speakers, invited speakers is Dr. Grace Kolopis, and she's from Samratulangi University, Indonesia. And today she's going to present primary healthcare service delivery during COVID-19 pandemic, lesson learned from Indonesia. Let's welcome Dr. Grace Corompis.
Thank you very much. The respected committee from UNPE University of Medical Technology, distinguished speakers, all the participants, ladies and gentlemen, I would like to present things that can be learned from our country, which is Indonesia. And please excuse me to share the slide. Okay. So my name is Grace Corompis from Samratulangi University. Thank you, Dr. Aaron, for introducing me. I would like to present the primary healthcare services delivery during this pandemic, and then this lesson we got from our country. So after introduction, I'd like to present the aims and methods of the research. Actually, this presentation is part of our ongoing research, and I would like to present some of our current findings, and then we'll close with the conclusions. As we know that the pandemic of the COVID-19 has affected most of the countries in our planet. Per yesterday, June 29, we have almost 200 confirmed cases and then almost 4 million deaths around the world. China.
Excuse me, Dr. Grace.
Yes.
We can't see your slides by now. Could you redo it again?
All right. Okay.
Okay. It was okay, but I just all of a sudden we lost contact with you, so it was okay, but
all right. I'll try again.
Thank you.
Okay.
Okay. Thank you.
All right. Okay. I think I'm going to start again from here. This is the data that we all know about a country where all the cases can be found in America, in France, and also in other parts of the world, Brazil, and also India, and of course from Taiwan, where you come from. It's about 14 million. This is the data that I got from WHO, and our country currently have been collecting about 2 million active cases. By yesterday, we have more than 2 million confirmed cases, and about 10% of them are active cases. Fortunately, we have almost 90% recovered cases and almost 3% of deaths. Of course, the emergence of severe acute respiratory coronavirus and its association with increased cases like what we have seen now and related deaths has exposed gaps in health system around the world. And while our focus mostly for this 2.7%, we also realize that the role of primary healthcare or puskesmas in Indonesia, that's what we call, is also important to look. So our research aimed to analyze roles of primary health centers during this pandemic. And also we examined the factors related to health service delivery by primary health centers during COVID-19 pandemic. What we have done, we conducted the systematic review, both from the existing policies and also from peer review journal articles. And also we conducted some interviews with the heads of primary health centers in our city, in my city in Manado, North Sulawesi, Indonesia, and also some staff of those centers. What we found in the policies related that since the beginning of this pandemic, our government have several policies related to the flight suspension. Emergency response team was formed, and also the presidential decree on the acceleration of the COVID-19 handling led by a task force steering council, and all other policies related to not only the health but also other sectors. Particularly for primary health care, our government have instructed and also have released the technical instructions for health center services during the COVID-19 pandemic. This is all about the adaptation of new habits and check flow at the puskesmas. We can see that the roles in puskesmas or primary health centers is stronger than before in terms of prevention and also promotion. So the primary health centers have roles such as informing patients and the community about COVID-19. And this also important because puskesmas or the primary health centers have played the important role in interrupting the chain of transmission of the virus and minimizing the spread, and also in terms of the epidemiological surveillance. Puskesmas also play important roles in identifying and protecting individuals and population groups who are particularly vulnerable. So their roles is important in terms of testing and tracing. This is some of the observation that we made that the acceptance of the patients in primary health centers in Manado have changed, because previously there's no need for checking a temperature and also social distance, but now every primary health centers in Manado and also around Indonesia have to implement such rules. These also have applied in terms of the accepting patients, where all the things and barrier between staff and all the admission staff and the coming patients have applied, which absence before pandemic. From the interview and by the set of questionnaires that we asked for our participants or our samples in this research, we found that the some factors influencing healthcare services delivery in primary health centers are organization, leadership, and policy. But the leadership is the one that plays the most important factor. So we can conclude from this preliminary study that the primary health centers in Indonesia have adjusted accordingly to meet needs of primary healthcare needs of the communities during COVID-19 pandemic. Factors such as leadership, human resources, and policies play important parts in delivering primary health services for communities during COVID-19 in Indonesia. Thank you.
Thank you, Dr. Grace Corompes. Thank you for your excellent speech and presentation. We really love it. And the next speakers we have here is Dr. Pei Fen Lin, Professor Lin. She is from the Yuanpei University of Medical Technology, and today she's going to present communicable disease prevention. Let's welcome Dr. Lin.
Okay. Thank you, Dr. Chan, for your introduction. My dear colleagues, dear participants, good afternoon. I'm Pei Fen Lin from Yuanpei University of Medical Technology, Department of Nursing. Did you see my share screen, or should I do it again?
So far, so good, I think. Yes.
Okay. You can see my PowerPoint now, right?
Yeah.
Okay, thank you. I think it is my pleasure, my great pleasure to have this short talk about the topic of communicable disease prevention, Taiwan experiences. I'm not going to focus on only COVID-19 itself. I will take a broader perspective to talk about our experiences about all the communicable disease prevention principles in Taiwan. The communicable disease, like its name, you will get it only when you have the contact with the disease, no matter directly with the agent itself, for example, the bacteria or the virus itself, or indirect by the transmitter, like food, water, or some equipment. And communicable disease has existed as long as the human history. When 1492, Columbus sailed his boat to America with his crew, he also brought the bacteria from Europe to America, which almost extinct Aztec people in South America. And I will show you a few pictures to let you get some feeling about how the communicable disease influences people's history. On your left-hand side, you will see the famous picture. That's the plague doctor in 17th century in Rome. Those pictures, you will see the doctor wearing the gown with the bird head mask. I think it might be the world first mask, medical mask. And on your right-hand side, you will see the picture shows the big hit of cypher fever of Ireland in 19th century. And one of the most famous flu that will be on your left-hand side, the Spanish flu in 1980 through 1920, which killed almost 100 million people in only 18 months. And not to mention the HIV/AIDS, because HIV/AIDS still today, they are the severe public health problem for many, many countries around the world. And most of the people you are not, you must be familiar with this picture. It's about the COVID-19. It happened all around the world. So we don't know when this disease will lasting, but till now, till this year, June 1st, the global deaths of COVID-19 already reached 39.3 million people. So according to WHO definition, what is the communicable disease? So when you look at the definition, you will find out three major elements here. The first one is agent. They will say the bacteria, virus, parasite, and fungus, and they will spread. So you must have a transmitted pathway, and you have a host. So you have to transfer this pathogen from one to the other. So this is the model, which is the classic epidemiological model we call the epidemiological triad. They told you the three elements we just mentioned in the WHO definition. So from this epidemiological triangle, you will see the agent. So for the agent part, the key point of the agent is the agent's toxicity. That means how severe, how easily this toxication will invest the host. And for the environment, from this environment perspective, for example, the COVID-19 virus, they will stay longer with the lower temperature, and also the population density. When you go to the crowd, the people, many people, they will increase the chance of interaction, also will increase the opportunity to transfer the pathogen from one to the other. And the last element is the host. The host usually will be the person or the people, and the demographic data of the people will be very crucial. For example, the age and their history of disease. So for many disease, the people get older or you got the chronic health condition, you will be more vulnerable to get disease. But there's an exception. That will be the STD, sexual transmitted disease. The younger people, they are more tend to live to be sexually active. So they got more opportunity to get STD. So how these three elements communicate together, that will conclude to the transmission pathway. There's two types of transmission. The first one is direct transmission. You can get the virus directly from the patient, the droplet, for example, patient cough, sneezing, so you can get it easily. For example, the flu, the tuberculosis, even the COVID-19, or directly contact by the membranes or tissue like STD. And the other way will be the indirect transmission, like from air, from food or water, like cholera. You get cholera by eating the contaminated food or drinking contaminated water, or from the vector, like mosquito. When you got the mosquito bite, you might get the malaria or dengue fever. So we conclude the things, we summarize that there are three elements and they has many transmission pathway. Then how can we deal with that to block this kind of transmission or this kind of communication so we can stop the disease? So there are several interventions we can use. For example, you can use the medication to eradicate the agent. That means you can kill the bacteria or the virus. And other ways, you can put your efforts on the environmental control. For example, during this COVID-19 pandemic period, when Taiwanese people go to shopping, when they get into the mall or the store, they will be asked to record their footsteps and taking body temperature and using alcohol spray to wash their hands. Or we will quarantine those diagnosed patients. And for the host, we will ask most of the people, encourage them to get the vaccination to improve their immunization. For example, eating balanced nutrition and regularly exercise and educate them to get the personal protection strategy. And also our webinar is another strategy because we avoid the close contact. Okay, I got 2 minutes. And the next one, I'm talking about the 3 levels of prevention. And here I want to introduce you to APP. The first one is the disease housekeeper APP. This kind of APP is a very good equipment or instrument help most people, our population, to prevent or understand what is the COVID-19 and what they can do. So it is a kind of an interaction APP. So people can get information, for example, the pandemic report nationally or internationally, and ask questions by the APP, and the CDC will respond your question in a very short period of time. And for the secondary prevention, we have another APP called the National Health Insurance APP. And in this APP, you can book your PCR test, you can book your vaccination, and recording your footsteps. And also you can search your medical resource around you by this APP. So that will help us to do the secondary prevention. For the tertiary prevention, we have both the hospital system and the public health system. Both systems will help the people recovery from the COVID-19 to get their health need and the medical need. And the last one, in conclusion, this is a poster that come from our CDC. They give you the 12 tips to prevention the communicable disease. For example, wash your hand, wearing mask, stay home and go to doctor, and drink boiled water and eat cooked food. All kinds of things will give you the tips to keep you safe and healthier. I hope those tips will help all of us to safe and healthy and during this kind of difficult pandemic time. Thank you very much for your attention.
Okay. Thank you, Professor Lin. I think we get a better understanding of the pathway, how we possibly get the pathogens. And thank you very much for that. And we are going to have a 5 minutes break because we were a little bit late for the seminar. So we just have 5 minutes break, and please come back after 5 minutes. And thank you very much. All right, we are going to wait for 1 more minute and 1 more minute, so please come back. The second section will be start in 1 minute. News. Okay, ladies and gentlemen, dear distinguished speakers, participants, we are going to get started for the second half of the section 1. And our invited speakers, Dr. Jessica Cristanti, she's a lecturer from Sojin Prananta Catholic University. And today, her topic will be focusing on decision support. And let's welcome her.
Thank you, Aaron. Please, I will share screen.
Okay, please.
Okay, I would like to say thank you for respected committee and speakers. I will start my speak. Okay, we will talk about non-communicable disease prevention, focusing on decision support. So before that, NCDs become the most important public health challenge, especially in cardiovascular disease, cancer, respiratory disease, and diabetes. And to combat NCDs, we usually should know about risk factors. And risk factors itself, there's a modifiable risk factors and non-modifiable risk factors. So what is all kind of risk factors? Risk factors usually like genetic factors, environmental factors, socio-demographic, and self-management and medical conditions. But the modified risk factor come in two primary form, especially in factors of self-management and medical conditions. So what is the behavioral risk factor? Usually behavioral risk factor we can also state like self-management. Behavioral risk factors is like tobacco use and physical inactivity, unhealthy diet, and harmful use of alcohol. And for metabolic and physiological risk factor is same like medical conditions. It's like hypertension, overweight, and obesity, hyperglycemia, and hyperlipidemia. But people with poorer economical, socioeconomical status may be more vulnerable about this. And before the pandemic, NCD now being responsible for approximately 72% of all death. By 2020, is predicted causing 7 out every 10 deaths in low middle income countries. And people with existing non-communicable disease usually during pandemic is particularly vulnerable to health risk because they have a weakness in his immune system and also his protective effect. And people who suffer from chronic disease such as cardiovascular disease, chronic lung disease, and diabetes are more vulnerable to disruption and stress induced by this pandemic. So we need to strengthening NCD self-care and disease management during the pandemic so it could mitigate the health harm caused by COVID-19. In addition, we should maintain the healthy behavior from the patient and healthy people, like regular exercise and personal hygiene. And for NCD's patient, we should continue the regular medication that we should recommend them to stockpile at least 1 month supply medication during this pandemic. But in Indonesia and also maybe another country, because of this infection control measures such as a lockdown or PSBB in Jakarta, many people with NCDs have difficulties to have access, such as not having at least 1 week supply of NCDs medication and difficulty in getting medical consultation or follow-up visit, and difficulty to purchasing supplies such as face mask and hand sanitizer during this pandemic. And also during this pandemic, the implementation of measures have to prevent spread of COVID-19. It's also exacerbating behavior such as unhealthy food consumption, physical inactivity, and sedentary behavior. So this behavior could make obesity much more higher, and obesity is risk factor for adverse outcome of COVID-19 infection also. So, but this implementation could increase people to cook and eating at home. On the other hand, this presents opportunity for preparing more healthy meals at home. But if people have a lack in nutritional knowledge and cooking skill, maybe people will increase in snacking behavior and unavailability and increase cost of healthy food and lack of guidelines to ensure nutritional quality of food parcel of the poor. And then people maybe will buy more unhealthy processed food consumption. So this COVID-19 control measure will disrupt routine daily activity, and so it may have a positive or negative consequences on physical activity behavior at home. Stay at home order and could reduce traveling and walking, and potentially reducing opportunity for physical activity. So reduce regular activity alone and with combination with unhealthy eating may result in an increased risk of worsening of chronic conditions such as obesity, diabetes, hypertension, and cardiovascular diseases. So is it important to us to mitigate indirect negative consequences by encourage people having a safe physical activity? So for prevention, the NCD, we should know about the protective factor. The protective factor could decrease a probability that people acquires an illness or condition such as NCDs. They also support health and function ability. What is a protective factor in NCDs? So we know that we should consuming a healthy diet, physical activity lifestyle, healthy weight, non-smoking, and no or low alcohol consumption, and sufficient rest and sleep. And for many of information communication technology gadgets, such as smartphones and Android or iPhones, have designed to promote a protective factors itself. In transition of health promotion method, this is important during this pandemic. And one of ICT strategies to promote protective factors is decision support system. So what is decision support system? Decision support system can aid both the public and healthcare professional in their daily healthcare and treatment decision. So the healthcare professional could do a preventive action planning. The role of support decision support that they could have a combination to help health prevention from global level until to individual level. And the role of decision support on NCD prevention is health promoting decision support and NCD risk assessment, automated identification, decision for healthcare professional, and planning and customization preventive intervention. This is the example for decision support. For example, there's two ways to reduce cancer risks. The cancer risk, to reduce cancer risk, we should not smoke. And how decision support could help? They give a fits of mobile menu that working and give a mental support. And then take actions to have healthy body weight. They can make shopping lists and join groups, and being a physically active and motivational messages and so on, and healthy diets. And this is on this the examples. And there's evidence said that food database in clinical decision support could be promising people to assist breast cancer patients to comply the dietary and lifestyle modification during pandemic. And for this conclusion, this health revolution could transform a continuous NCD prevention and health promotion process. We hope that people could get the information and awareness 24 hours by this system. Thank you.
Okay, thank you, Dr. Jessica Christian.
Thank you, Errol.
And we are going to, I would like to bring up your special notice that today we are so lucky to have our distinguished chair professor from our university, Yuanpei University of Medical Technology. He's also our vice president. He's a very outstanding scholar in his special field. And let's welcome Professor Dr. Chow Yi-Hong. And today he's going to present the role of medical imaging in the prevention of non-communicable diseases. And let's welcome Professor Chow.
Thank you very much, Professor Chang, for your kind introduction. And good afternoon, Selamat. My topic is the role of medical imaging in the prevention of non-communicable diseases. And I'm presenting on behalf of me, Professor Tu, and Professor Lin from Yuanpei University. The so-called non-communicable diseases, also known as chronic diseases, is not like COVID-19. It's not passed from person to person, not infectious. It is usually caused by genetic or lifestyle factors, and it's a kind of diseases of long duration and generally slow progression. And Dr. Jessica Christian already mentioned about the risk factor of NCDs. And the four major types of NCDs include cardiovascular, cancer, chronic respiratory, and diabetes. So CCCD. We all know that prevention is better than cure. And we have to focus our energy because a lot of things we have to do. As medical imaging workers, poor radiological technologists and radiologists have to face thousands of images and have to do hundreds of examinations per day. But still, we can help in the prevention of non-communicable diseases, for example, screening. In the very famous book by Charles Dickens, A Tale of Two Cities, Dickens wrote, "It was the best of time, it was the worst of time. It was the age of wisdom, it was the age of foolishness." I'm not quite sure it is the best or the worst of time for medical imaging experts to face the screening programs. In screening for non-communicable diseases, we have to know the value of screening. We have to know the burden of non-communicable diseases, the screening programs, and the goal of medical screening. When the government or the decision maker have to make a decision from decision not to screen or to screen, they have to face the important balancing between cost and benefit. The costs include financial cost and human costs such as anxiety, discomfort, adverse effect, follow-up investigations and treatments. And the benefits should be supported by the healthcare infrastructures to support screening services and to get the benefit of preventing disability and death, and the quality of life can be improved. But it is not an easy task. When the decision to screen is made, we have to focus on the specific disorder that screening is intended to prevent. For example, screening for prevention stroke rather than screening for hypertension. So there's a specific disorder, and the screening test should be a kind of safe and simple, non-invasive, easier to perform, and less expensive than diagnostic test. And if it cannot yield definite result, then it should be supported by diagnostic tests. So choice of screening test is important. For example, when you're facing lung cancer, you can have chest X-ray, CT, PET-CT, MRI. And if you face breast cancer screening, it could be mammography, tomosynthesis, ultrasound, MR. For example, the more recently developed system by using 3D CT, then you can screen both lung nodule and coronary artery calcifications. So it could be the future screening program for lung and heart. For the breast, for example, you can have mammography, but never forget ultrasound will be also very helpful to see these kind of tiny lesions about 0.5 centimeter in size. So take breast cancer as an example. Breast cancer is the most common type of cancer and the second leading cause of cancer-related death among the women in Asia, accounting for about 39% of all breast cancer diagnosis worldwide. And the incidence of breast cancer in Asia varied widely across the continent and is still lower than Western countries. However, proportional contribution of Asia to the global breast cancer rates is increasing rapidly in parallel to the socio-economic development. So you can see very high percentage of breast cancer. And here you can see the list from Asia and some Southeast Asia. Here you can see Korea, Japan, and Taiwan got similar cancer patient incidence. For example, around 50 women per 100,000 population. So that's in Taiwan. But in Indonesia, here you can see about 40 per 100,000. So Indonesia a little bit lucky, but with the time, I know the burden will be increasing. And in Asia, particularly in Southeast Asia and East Asia, here you can see the income, the GDP is really high in Japan, Korea, Taiwan, Malaysia, China, and also Indonesia. So all these 6 to 8 countries are capable to screen breast cancer. And now in Southeast Asia or Asia countries, although breast cancer is the most common type of cancer for women in most countries, it is often suppressed by cervical cancer in most countries in Asia, particularly Southeast Asia, where most government health service focus on the relatively easily managed screening program for cervical cancer. But I believe Indonesia can do that. Because we start quite early, South Korea and Taiwan started in the 1990s for breast cancer screening, and Japan followed. For other countries, including Indonesia, they got various screening policies and programs. In Taiwan, we have mammography, we have ultrasound screening program. And remember, if you want to do this kind of screening program, you should have very strong infrastructure to support the screening program. For example, in Taiwan, we have a lot of training program and educational courses. Then we got consensus. And also awareness promotion is very important. We have a different kind of mobile women's health, breast health, and mammography service to communities. And starting quite early for the high school student and university female students, they all got enough knowledge about breast cancer. And for some countries, for example, Thailand, they have a breast cancer awareness enhancing program, and they do the so-called breast cancer awareness scale to check the awareness in different population. So that's a start. And never forget that imaging screening technology is also important. This is an example to show you the tiny pathologies can be detected by using this kind of automatic scanner. You don't have to do the examination. You just put the machine on the breast surface, then you can detect the tumor. So that's a new technology. And AI will be very helpful in the coming years. And AI in particularly helpful for subtle lesion detection, such as these tiny lesions. But here you can see AI never said, I'm tired. But for radiologists or radiology technologies, they are so tired for screening programs. So thank you very much for your kind attention. And hopefully, I think it's a waste of time be an optimist because we have a lot of new devices can use. Thank you again.
Okay, thank you very much, Professor Chow. It's the Vice President from Yuanpei University of Medical Technology. And this will be the end of the keynote speech, but we are going to have a Q&A section. And if you would have any questions, you are more than welcome to ask. And I would like to remind speakers, if you can check the chat box, we might have some questions already there waiting for you from our audience. And okay, Professor Chow will be, okay, thank you.
Thank you.
Okay, let me see. So we have questions. Dr. Johannes? No, this. I didn't even. So audience. We have a question for Pei-Fen Lin, Professor Lin, this one. Lee. Okay. Okay, we have Professor Johannes got a question to all speakers. How do people behave in a new normal situation after COVID-19, especially in health sector? Looks like the cost will be more expensive. Does any one of you here would like to comment? How do people behave in a new normal situation after all this COVID-19, especially in health sector? About the cost. Anyone would like to? Okay. Or we also have another questions for to Professor Pei-Fen Lin. Would you explain more about the safety practices of the primary prevention? You share with that?
Thank you for the audience. The question about the safety practice in the primary prevention level. I think the safety practice is in everywhere and any aspect. For example, we can raise an example like STD. To prevent STD, the safety practice will be using condom and place safety sex. For example, abstain, be faithful, or using condom. That's the slogan for the AIDS prevention. So in many ways, in different kind of communicable disease, you always find the way to do the safety practice, including now we are preventing the COVID-19. We wash our hands all the time, wearing mask all the time, and that's the safety practice. That's another example. So it can be many ways and influences our daily life. Thank you.
Okay, thank you, Professor Lin. Thanks. So we are going to stick with those rules. Otherwise, we are going to get some unwanted disease as well. Okay, what I see from my screen is there's another question for Dr. Jessica. Jessica, could you answer it? Would you like to give a comment? Does decision support include IT support?
Yes, it includes IT support. So as decision support is just one of health ICT ecosystem. There's so many like gadgets, mobile apps, and then so on, artificial intelligence, and so on. But I just focus about decision support system. Usually, decision support system will be used in healthcare. For example, like if I'm doing a medical checkup and I found a patient result, and the software could give me a notification like should we check examination A, examination B for preventive ABC, like that. But unfortunately, not all Indonesian hospital have the system like that. I just know that in overseas there's some literature that they already adopt that, but in implementation for the medical checkup like that is so important for healthcare officer, because usually we can do the examination for 100 to 200 people sometimes in 3 days, and we need that support. But for personal decision support, it because that we at home, not now because of the pandemic, we can attend like symposium or offline webinar like just like before. We just now see through the handphone and application, and by that media we know about the health promotion like in that place. Even in Indonesia, we have a new jargons or new abbreviation like kulwap. Kulwap is kuliah WhatsApp, that we do the health education through WhatsApp. So people could ask by chat about their health, and we give the education by sending the video into WhatsApp group like that. Thank you.
Okay, thank you. So that's wasa. Wasabi wasa. Okay, just a full joke. Thank you very much for that. I think, there's a last questions, I think. That's a question for Professor Yi-Hong Chow. And the question is like, the description is like, there is a trend that many medical equipments are getting lighter and portable. My question here is that they are the imaging data from the portable ultrasonic reliable compared to the fixed one? And please.
Thank you very much. The question forwarded from Yo-Yo is a good question, but it's difficult to answer because it relied on the experience of the operator. So actually, nowadays, the so-called portable machine is quite good, and it's good enough to do diagnosis. But for screening, I think we need a relative dedicated machine, because if you want to do screening, you have to pick up tiny lesions. So it's a little bit different from diagnostic. In diagnostic part, because patient could be, symptomatic, the patient could be, diagnosed as abnormality, found in other image modalities, so the diagnosis will be relatively easier. So I would say the hand-carried machine is good, but for a screening program, we need more experienced hands to do that. That's the answer. Thank you.
Okay, thank you, Professor Chow. And okay, I got another question here. The question. Oh, this will be the last question for section 1 because we need to go proceed. The question for Dr. Columbus, from your perspective, what is the challenge of COVID-19 prevention for primary health service in Indonesia? Dr. Columbus, please.
All right. Thank you. Such a great question. In our country, particularly for the health service delivery from primary health centers, it's been always a challenge in terms of delivering services for the community because most of the primary health centers are located in remote areas. So the challenge in terms of access, geographical access, and also the infrastructure, because we know most of the remote areas have limited support systems in terms of transportation. And also it currently becomes more pivot in terms of the using of the information technology, because we have to admit that there's still some parts of Indonesia where even electricity is still a problem, is still an issue. So not to mention about the technology information. So that's one challenge in terms of the infrastructure. And also we have also still have challenge in terms of the human resources. So especially in terms of the distribution for primary health centers who were located in cities, it's not a big challenge, but for those who located in remote areas, there's still some parts where doctors, nurses, and all health human resources are limited. So those are some challenges, I think. Thank you.
Okay, thank you for your comments. And because of time, well, I would like to put few words before I end it. I just feel like so many data showing so many dead people from speakers to speakers. Well, my personal feeling is like we still have to be positive. We have to treasure ourselves as wonderful living creatures and be positive and keep happy and for the rest of our life. And I call it, this is the end of section 1. And I'm going to transfer my microphone to Dr. Xiaoling Huang because we don't have a break between these two sections. Okay, so this is the end of section 1. And thank you very much for all the speakers and distinguished professors. Thank you.
Thank you for Aaron's introduction. Good afternoon, ladies and gentlemen. My name is Xiaoling Huang. I'm from Yuanpei University of Medical Technology. I'm associate professor from Department of Healthcare Management. I personally enjoy all the presentations so far because of my expertise. My expertise is also public health. And from now, we also have more to come, including international collaboration and also the research activities. So the first speaker of session 2 would be Johannes, Dr. Johannes. He is Deputy Director of Sahid Foundation and also assessors of the National Higher Education Accreditation Board from Polytech Sahid. He is going to present health and wellness tourism prospects in Indonesia. Please, Johannes.
Thank you. Thank you so much. I appreciate with Yuanpei University of Medical that organizing is very important and strategic webinar. Now we would like to presentation focus on tourism perspective. Previous talking about health, and now we talking about health and wellness tourism perspective in Indonesia. Oke.
Pasti ditutup sementara. Kalau memang masih menakutkan.
Oke.
Yes. Justru malah nakutin diri sendiri.
Okay, my presence okay? You can see it?
Yes, and please,
okay,
Jordan, could you turn off the mic? Thank you. Yeah, the PPT is perfect, Johannes. Okay,
thank you. My topic is health and wellness tourism perspective in Indonesia. Our discussion today is prospect of health and wellness tourism in Indonesia and also international cooperation on health and wellness tourism. That is my point. Actually, Indonesia is the big country. The current issue is we have population 300, more than 300 million. That is the big potential, especially in health also. Location is attracts for health and tourism. Yeah, various region, the big country. And Indonesia now, the people, new lifestyle of young generation, concern on health and wellness. That's why there is so many opportunity to develop in health and tourism. Also, Jokowi, the president now, the priority to develop the target work of the last president. It's been in 1924. It's to develop now its infrastructure. That is to develop in all the area of Indonesia to support tourism as well as in health also. And as you know that the result of the research, the number of Indonesians seeking treatment abroad from year to year is increased. Data in 2015, more than 600 patients with expenditure more than 11.5 billion a year. I think for the next will be increased. The reason is lack of service quality in our country, communication problem, as well as diagnosis accuracy, advanced technology, as well as accommodation of prison and worldwide reputation in hospital and cheaper. Hopefully for the next, Taiwan is the destination also. And this is the figure of the result of the Zurich Insurance. This is the point of what we call it, the Indonesian. Actually, the destination, health destination main in Malaysia and Singapore. Yeah. What the type of treatment looking for Indonesia patient? One is cosmetic reconstructive surgery. Yeah. Me also, I think all the people want to have wellness and happiness. So the first cosmetics remain young, slim, yeah, something like that. Also cancer, bone treatment, dental, spinal surgery, eye treatment, weight loss surgery. Yeah, the economy in Indonesia also rise, and then the young people will fat, overweight, and health medicine. This is the profile of wellness traveler. The first health and physical, integrative medicine, diagnostic, health checkup, chronic condition. As you know, our people from Sumatera Utara, North Sumatra, also Padang, also Bengkulu. If any problem in medical, they go to Malay, not to Jakarta. It's very far, yeah, so expensive. Also, mental about the spa and beauty. This is a need of us, like massage, body treatment, facial, hair and nail, something. And also kind of spiritual. We want to go to visit us mind, body, yoga, medicine, yeah, Tai Chi, Qigong, and so on. Also the prayer, volunteering time with family and friend, retreat, and emotional, environmental, with the environment, they want to hiking, biking, and social. Yeah, social is like gym, fitness, stretching, Pilates, and so on. So the health and wellness tourism be kind of the category. The first is medical. The second, wellness and herbal tourism. The third is sport and health tourism. And fourth, the health and scientific tourism. I think Taiwan is good for the scientific. Also, Indonesia need a cooperation with your country. How the tourism mapping development in Indonesia and the priority tourism. Actually, we have 10 priority destinations. This is location of how to develop tourism destination, as well as health and tourism. Sabon dan Toba and Aceh till Raja Ampat in Papua. How the strategy new normal in Indonesian tourism roadmap? I think this is related with the health and wellness. The one is the quality tourism. More value, high spending, protect, respect, also the culture. And the second, access connectivity. I think in medical health should be use of the high technology, IT. And the third is cleanliness, healthy, safety. Yeah? The fourth, destination reputation, about amenities, health support, culture, and sustainable. And the fifth is digital ecosystem. The one who's Kaisen talking about IT. And the sixth, quality human capital. We know the weaknesses in the human resources. Product development, product for health tourism, product for wellness tourism, also industry government management, the business model, investment, finance. That is need of international relationship. Also 9, communication, promotion, and marketing. And the last, the 10 is creative and innovative. Yeah. How about the SWOT analysis? We try to analyze the strength is the population. We have the health, wellness, tourism, object attraction. And also we have some asset of wellness surrounding Indonesia. And weaknesses, health and fitness attraction in Indonesia not yet developed. And opportunity, I think, you know that new market and health and wellness, so economic Indonesia more and more increase, okay, and trade. Okay, this is the concept framework of development, health and tourism policy. Yeah, we consider medical, wellness, and tourism to support in others' facility. And our conclusion is the strategic framework for Indonesia health is one is change of mindset of all stakeholders. And the second, focus on sustainable tourism and new normal indicator adaptation and adoption. And customization of new mindset of health and wellness tourism, green job, new normal, international relationship, sustainable tourism. And the fourth is introduction of control mechanism and enforcement. This is my presentation. Thank you so much. Thank you.
Thank you very much for Johanna's presentation, and your time control is perfect.
Thank you.
And thank you for your wonderful presentation. And the next presenter is Dr. Jordan. He is Director of International Relations Office of University Muhammadiyah Yogyakarta. He is going to present the topic of enhancing cooperation between ASEAN and East Asia countries through counterparts. Lesson learned from Taiwan and Muhammadiyah higher education. Jordan, please.
Thank you very much, Sharon Huang. Let me just share the screen for you. Wait a minute. Oh, not this one. Because could you help me to just find this, because for sharing that, I don't know, I actually doing that well, but
If you click on the share screen and you need to choose the desktop, so you need to click again. Can you manage?
yeah,
Okay.
sharing PPT. Oh, okay, right. Okay, right. Thank you very much, Sharon. And
Okay, great.
yeah.
Don't worry, we will just count your time from
Okay,
the
right.
start
Thank
of
you
your
very much.
presentation.
So good afternoon, everybody. My name is Yordan Gunawan, and today I would like to present my presentations under the title, just a minute, the enhancing cooperation between Asian and East Asia countries through counterparts, lesson learned from Taiwan and Muhammadiyah Higher Educations. I'm Yordan Gunawan, a chairman of the Associations of International Offices of Muhammadiyah and Asia Higher Educations in Indonesia, and also director for International Relations Office of Universitas Muhammadiyah Jakarta. I just start my presentations by explaining about what is Muhammadiyah. Muhammadiyah is actually the biggest Islamic movement in Indonesia and founded by Kiai Haji Ahmad Dahlan in Jakarta, Central Java, in November 12, 1912. It is actually the modern and reformist social religion organizations. And then it moves toward the purifications of practicing Islam in Indonesia based on Al-Quran and also Hadith. When you see this map, I show to you that Muhammadiyah headquarters is actually in Jakarta, but we have also a central building in Jakarta, approximately, but not. I think this one is not my new. Not my new PPT. This is old PPT. It's about 6,000 kilometers, 5 hours flying time from Taipei, and then 1 hour time difference with Taipei. Then this is the structure actually. So we have a central board of Muhammadiyah, provincial board and district board and sub-district board. And also we have the also the representative from the village all over Indonesia. And then in the word Muhammadiyah also has the Muhammadiyah special chapters, as you can see in Egypt, Iran, Sudan, Netherlands, Germany, United Kingdom, Libya, Taiwan, also Turkey. Even in Taiwan, we have also two branches in Taipei and Taichung, facilitated by Asia University, Taiwan. And then this is the chairman, started from 1912. Now the chairman is Professor Haidar Nasir. And then he's also the professor at the political science of Muhammadiyah University of Yogyakarta. As the largest social and religious organizations in Indonesia, with nearly 30 million members, actually Muhammadiyah has many assets, started from the kindergarten and then hospital and university, higher education, boarding school, senior high school, junior high school, and special defable rehabilitations and others. Because Muhammadiyah actually was created by Kiai Haji Ahmad Dahlan with the special motto, how to serve the ummah, how to serve the society from the problem that they face, especially for the poor society. And then in Muhammadiyah, actually, it consists of the central boards, and you can see also under the central board we have many councils. And then I would like to focus on the Council of Higher Education and Research and Development, which will cover all the universities and higher educations of under affiliations of Muhammadiyah in Indonesia. But others, you can see Council of Producing Fatwa, Council of Da'wah, Council of Law and Human Rights, and others that will cover all the society's problems. But let me just go and focus going to the Council of Higher Education and Research Development. This Council of Higher Education and Research Development, if I can describe to you all, it is like the ministry for Muhammadiyah higher education, since when we just compare the number of the universities in Indonesia, Universitas Muhammadiyah Yogyakarta, Universitas Muhammadiyah under, universities under the affiliations of Muhammadiyah, I think the most universities in Indonesia, as you can see here. So in public university, only 4%, and then the 5% is Muhammadiyah universities, and private universities is 91% in Indonesia. As you can see, and in terms of the number of the universities, Muhammadiyah has even more than the state-owned university. And then the last update for yesterday's, I found that actually in higher education institution in Muhammadiyah is 163, because some of the colleges and also academy, they just merged. Then now we have about 67 universities with 73 colleges, 4 academy, 13 institute, and also 6 polytechnics. And this is the logo of some of the Muhammadiyah universities, also institute in Indonesia. Then if we collect all the lectures, we have about 13,690 lectures Muhammadiyah owned and 2016. And then the students, we have about 502,977 for the students. But I think the numbers is a little bit higher than this number. And then the collaborations under the Muhammadiyah, because actually the collaborations is not only conducted between the university, but sometimes because Muhammadiyah also would like to facilitate the University of Muhammadiyah, Muhammad University, which under the development under still in developing, so developing situation, so they need to be facilitated by the by the council. And then the collaborations scheme, which is provided by the Muhammadiyah Muhammadiyah Higher Education Council, is visiting professor, sabbatical leave, joint research, joint publications, student exchange, postgraduate studies, and also joint and dual degree. Then I would like to give you an example because actually, as I told you previously, that Muhammadiyah Higher Education consists and divided into 3 levels. The first is developed, the first is developing, and then the third is the young universities and higher education. So with new collaborations with Taiwan, as you can see here, our university actually has many collaborations. For example, as you can see with National University of Science and Technology, National Chia University, and then Untitled Asia University, you can see here. And then we have also many collaborations with 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, including the UNP University, and it is actively run between 2 universities. And then the most successfully activity which is conducted between Taiwan and also Muhammadiyah is the establishments of Taiwan Education Center and also Taiwan Higher Education Fair, which conducted every year in our university. And then the next year we also would like to establish Taiwan Indonesia Healthcare Education Alliance by Taiwan Education and so Taiwan Education Center and Mandarin Language TOEFL test. I mean, So this is the establishments of the Taiwan Education Center. For your information, it is only 3 in Indonesia, in Universitas Negeri Jakarta, Universitas Erlangga Surabaya, and also my university, Universitas Muhammadiyah Yogyakarta. Then all the collaborations also from 18 strategic partners of our university. I think you can see here National Cheng Kung University is one of the Taiwan's university which are very actively doing the research and also publications with our university. Then we also have the UMI internationalization program, and then many university of Taiwan also becoming our partners, and we are actively doing this kind of activity for internationalizations. I think that's all my presentations. Any questions and also responses are very welcome. Thank you very much.
Thank you, Jordan. Time control is also perfect, so I don't need to ring the bell. And thank you for your.
I love the bell actually.
You love the bell. Okay, I can send to you by post. Okay, thank you for your informative presentation. And if you have any question, you could, for the students and all the participants, you can leave the message on the chat board. And I believe some of you may already notice there are some questions coming in. So please keep on noticing this message from the chat board. And also, I would like to welcome the next guest speaker, Dr. Dian. She is Director of Partnership, Office of International Affairs from Universitas Islam Indonesia. And she is going to present the topic of change, chance, and challenge in the new normal. Let's welcome Dr. Dian.
Thank you, Charlene. Please let me share my screen.
Yes, sure.
Oh, wait a minute, something. Oh, okay.
Are you okay?
Yes, supposed to be like that, but something happened here.
Sometimes make people confused because this is the first time for us.
Yeah, I know. Yeah. You all familiar with maybe Zoom rather than Google Meet. Yeah, but for some, are you okay, Dian? You
not sure.
Yeah, because yesterday we did quite good. The rehearsal.
Yes,
so
that's right.
Maybe because of many participants coming to Google Meet now, we have 41 participants currently. So.
Oh, wait a minute. I think it's. Oh, I cannot share the presentation.
You cannot share the screen?
Because the Google Chrome may be not allowed to record. Oh, to record the screen.
Should we do from our side?
Yes, please. I think I have sent the final version.
Yeah. So maybe I can ask my colleague to share the screen, and you can just give us the. No problem.
Sometimes. Okay.
It's okay because Johannes and Jordan have very good control of the time, so we can.
Okay, that's good. So maybe I can reduce my time. 5 minutes.
Okay. So do you see your slide?
Looks perfect. Yeah.
Okay. So just give me say next, then we can do it for you.
Okay. Good afternoon, everyone, the honorable or my colleagues and speakers, and also all participants. I hope that you are staying safe and healthy. I'm Dian Sari Utami. I'm from the Department of Psychology and also the Director of International Office and Partnership in Universitas Islam Indonesia. It is an honor for me that we are invited to share our experience about global student exchange, change, chance, and challenge in the new normal. So please go to the next. Oh, okay. Thank you. Yes, so actually talking about global student exchange, I would like to differentiate about the issues of globalization and internationalization itself. As we know that we heard, I think 10 years ago, for more a decade or more than a decade, we heard about globalization and actually what is globalization. And globalization actually related with the interconnections among cultures. So mass cultures, which is in this world, that we call it network society. And this mass culture, we connect to each other and we call it global village. That's what we create in globalization, whether it is in the sector, economic sectors, whether it's political, cultures, and others. So globalization actually the spatial and interaction process. And go to the internationalization, what is it actually? So internationalization itself is like a strategy in the globalization and how we do something, how we try to adjust, how we try to adapt, how we try to be engaged in the globalization, in the network society, in the global village. So internationalization will be called as an engine of globalization. And it is focused on the international actions and consensusness and related with the issues of the academic mobility when we connect these issues, internationalization and globalization in higher education. So actually, academic fields, scholars, students, they are main factors, become main components to what to pursue this internationalization successful. And this will create the higher education policy. Please go to the next slide. Thank you. And this is what we have done in Universitas Islam Indonesia to respond to COVID-19. So during the pandemic since March last year, 2020, we tried to do some mitigation strategy. And the first, we divided this pandemic and until later the new normal era. We divided into three phases. The first phase is related with surviving, how to survive. And how to survive means that we try to be prudent, which is our focus is on the safety and also the academic sustainability. This is in our focus. And on the second phase, we focus on our healthy to revive. It means that we are working in the organizational sustainability, also pursuing academic quality. And the reviving phase started in the beginning of this year, 2021. So from January, and we predicted maybe until August. And start from September, hopefully we can start it with this accelerated phase to thrive. Which means despite of running the organizational sustainability, we can build our academic quality and making new business model in higher education to strengthen the international recognition. So please go to the next. Yes, and talking about mobility in higher education during pandemic, then we understand, I think in almost all or maybe all universities in the whole world, global, that we are now focusing on our safety, health, and also academic sustainability. And because of this, we try to do another strategy related with the student exchange, related with the students' mobility. That before we do it physically, now we do it like online. And please, next. So the first thing during the pandemic, it changed everything. It changed our lifestyle. It changed our ideas. It changed our ways to connect with others. I think it changed many things. And how it changed the global student exchange. First, that of course, the impact of this pandemic will make the quantity of student exchange will be reduced a lot. So we talk about student exchange, it means that any student is international students, no matter from which country or what kind of nationality, but every student, I believe, they are international students. So as reducing the quantity, and also we change our ways to connect with others to do this exchange from physical to virtual mobility. We also Universitas Islam Indonesia is part of the Pasar to ASEAN Consortium, which is under the ASEAN, and we make a guidelines specifically to do virtual mobility for student exchange. And this is the new things. And the next changing that we got, before I haven't finished, so previous slide, thank you. The issues of connections that now it's become borderless. Like now I know Professor Shen, I know Aaron, I know Pak Yordan, even we are in Jogja, but we haven't met before Pak Yordan. That's great, but now I met him personally, virtually, and even with Busiska, and yes, this is like a borderless connection that we have now, and even timeless. Although we have time difference, like in our experience, we have students from Germany. When it is in winter time, it has a 6-hour time difference. And can you imagine when we start our lecture at 7 a.m., it means that he has to wake up at 1 a.m. in his country, in Germany. So this is the timeless connections, but it's happened now. And also issues of digitalization. Now it's changed. That like now I try to do with Google Maps, Google Meet, but it's difficult to share my screen. It's part of the digitalization issues. I think no one can say that, oh, I cannot use this. I think everyone will think that everyone knows about how to use the platform to connect with others virtually. This is interesting. And related with this cross-cultural inclusivity, now we are not seeing others as, this is in my experience, we are not seeing others as you are someone from other countries. But now we see like we are one, we are united, we are global citizens. We can feel it, this sense of belonging of the part of this global citizens. That's what we feel. Okay, please. Next, yes. And now we move from the changing and with the chance that we face for global students exchange. I found this nice quotes from Melody Stratton, and she's a director of international from Boston University. Oh, okay, Clint. The focus on this chance is don't be afraid of the external circumstances, but it will teach us how to be resilient. It teaches us how to adapt. It teaches us how to see a new perspective. This is the chance that now we change our mind. And this is our chance to glean. Although we do it, collect this step by step, one by one. Please, next. Yes, and this is the challenge that we face now. As I told you before, that time difference, as I mentioned about time difference is very unique. It seems like only time difference, but it gives many impacts to the physical health, to the mental well-being, even to the communication barrier, because lack of this time difference. That's why we need to this supporting system and policy changing. This is also the challenge. Supporting system is important, but we understand that in this situation we face a policy changing rapidly. And technology issues. This is important because some parts of the other world, they don't have electricity, they don't have internet connection. This is what we face with our international students, like in Sudan, in Yemen, in many parts of the conflict places. So please, next. So the last but not least is the important consideration in the new normal for student exchange. So we need to focus on the quality rather than quantity of international students. Now we try to design how to get students, but with a high quality. We do some selections like an interview and really wants to know face-to-face virtually with the international students now. And a chance to choose. Now we see our paradigm, the freedom of learning. We can learn any subjects. I think it's good to open it to everyone. So everyone has a chance to learn anything. And future global mobility, now that we have to consider, and well-being issues. The last part is the most important thing. The last is. Thank you very much. So I dedicated to all international students that it takes a lot of efforts to make changes, but so be the change itself. Thank you.
Thank you, Dr. Dian.
Congratulations, Dian.
Thank
Thank
you.
you. Okay. If you have any question from the floor, you could type at the chat board or at the YouTube message board. Okay, the next speaker is Dr. Josephine. She's from UMP and she's my colleague, and she's also associate professor from Department of Optometry. She's also the optometry clinical consultant in USA, and she's going to present the topic, which is international collaborative efforts exploring protein aggregation, associated diseases, and potential inhibitors. Let's welcome Josephine.
Thank you, Dr. Huang, for your kind introduction here. I hope everyone had a pretty nice afternoon so far. Okay, let me go ahead and share my screen.
Yes, please.
Okay, 1 second. Can everyone see my screen?
Almost.
Okay, all right.
I think it's processing. Yeah, excellent.
All right, so today I'm going to be sharing a project that it's an international collaborative project exploring this protein aggregation associated disease and potential inhibitors. And I'm just going to share one since we don't have too much time. Cataract forming, which incidentally is the leading cause of visual impairments globally. And this is due to a misfolding of crystalline proteins. And you can also have corneal dystrophic diseases due to misfolding of transforming growth factor beta induced proteins. Now, my area of interest is, of course, in eye diseases. And we have several works published already on cataract. And there's an ongoing project on corneal dystrophy. Now, the work that I'm going to share today is mainly involving nanoparticles, since this is such a popular topic within the past 2 decades. And nanoparticles have found its various uses in a wide variety of fields, such as environmental, industrial, agricultural, and food, as well as biomedical field. And our interest is in its effect on protein aggregation. It can either enhance it, induce aggregation, or it can inhibit it, which is our interest in this study. Now, in the past, it has also been found that in our body, there are quite a few osmolytes, such as sugar, amino acid, and its derivatives that can help protein to fold properly and maintain its function. However, in a natural biological system, osmolyte has to be in high concentration in order to have this type of function. So in the past, there has been some other groups that harnessed the advantage of osmolyte and also nanoparticles to create a nanoparticle that's sugar terminated. They use glucose to create this multivalent nanoparticles to enhance its protein chaperone function, helping these proteins to fold properly. But the advantage of having these multivalent nanoparticles is in its high surface area to volume ratio, which means you only need low concentration of these nanoparticles in order to have its protein chaperone function. So we got an idea of creating our own nanoparticle or sugar terminated nanoparticle using a different form of sugar. We use sucrose instead. And this is a project that was published last year in collaboration with Slovak's Academy of Science. and where we use sucrose terminated nanoparticles to explore the fibroinhibition effect on beta-lactoglobulin. Now we use this is actually a model protein, and it's not really disease-related protein because when you're exploring a new, or you're creating a new nanoparticles that's never been created before, you need a more affordable system where you can mass produce these proteins to test out these new nanoparticles. So we ended up using beta-LG, which is a milk protein that can easily be obtained in mass quantities. So our key players is mainly we use this beta-lactoglobulin protein and induce its fiber formation. And then we created our sucrose-terminated nanoparticles by carbonization through heating and acidification. And we co-incubated the two together, and then looked at different concentrations of these nanoparticles and its effect throughout different time frames. And we characterize the nanoparticles once we create it through spectroscopic techniques, such mass spectroscopic techniques and microscopic techniques, as well as looking at its effect on fiber formation, looking at structural changes, as well as aggregation properties and their binding properties. And so here's the conclusion, or the results of our study in brief. Without any additive, we get fibrils forming with under the certain condition of incubation with this beta-LG proteins. However, when we added the osmolyte by itself, we get a mass of aggregation, even more so, more enhanced than the rate without any additive. But if we added sugar-terminated nanoparticles, we actually see a reduction in these fiber formation. And these were proven quantitatively through our other techniques, looking at structures, secondary and tertiary structures, as well as characterizing these fibrils. So we do see a concentration dependent of effect of these sugar-terminated nanoparticles. So all in all, we found that sucrose-terminated nanoparticles are effective in reducing protein aggregation. And in our future work, we will be testing out these nanoparticles on disease-associated proteins. Now, this project was funded by Ministry of Science and Technology of Taiwan, as well as research grants from Slovak Scientific Grant Agency. Thank you for your attention.
Thank you, Josephine, for your inspiring presentation. And if you have any questions, you can post on the chat board. And the next, and also the final speaker of our session is Dr. Agianto. He is the head of collaboration and public relations from Lambeth Magukulat University. He is going to present the topic, which is international collaboration as one of institutions striving to increase the quality. And let's welcome Agianto, please.
All right, thank you very much, Celine, for your introduction. I'm Agianto. Good afternoon, everyone. I'm from South Kalimantan of Indonesia. And this is a great honor for me to be one of speakers in this international webinar. And today I'd like to share about our activities in the Faculty of Medicine as well as Universitas Lambung Mangkurat about the international collaboration as one of institutions strengthening to increase the quality of our institutions. Next, please. In Indonesia, Indonesia for higher education, we have to implement and we have the responsibility to implement the 3 pillars of higher education. we call this Tridharma Perguruan Tinggi or three pillar of higher education, consists of educations, research, as well as community service. There are many activities in this three pillar of higher education, and mostly in every faculties or maybe in another institution, they conducted the education activities such as the student or lecturers exchange program, and then they develop the curriculum, as well as the academic activities such as today for the webinar, international webinar, seminar, and others. And also double or dual degree for education, human resource, and development. But for the research activity is still less number for the implementation. For example, in our institution as well. So research is also very important if we want to conduct the three pillar of higher education in our university. And this is the responsibility of the lecturer in Indonesia. So there are many activities that related with the research, especially for international collaboration. So we can implement the joint research publication, and then change the research material between universities or institutions. And another one for the three pillar of education is about community service. So we also concern this. But for today, I will explain more in detail about the research collaboration in our university. Next. So I will talk a lot in this slide. I will talk a lot in this slide about the faculty research collaboration. So if we want to implement the research, so it's not only collaboration or cooperation with the local area at national, but also in international level. We can collaborate with the government, the private sector, with NGO and academic institution, both national and international institution, as well as the industry. To implement the collaboration, but we usually discuss about the technical implementation of the research, such as findings, and then the implementation of the research, as well as where the research will conduct. The setting of the research. For the funding is very important as well. Not only important for the implementation for the research, but also this is can relate with the accreditation item, because in Indonesia for accreditation for research, for research item, they usually ask about the funding. If the funding is come from our partner collaboration, is very high score to increase the accreditation score of our institution. But sometimes our partner can share half of funding to conduct the research. But sometimes they give and they cover the full funding to implement the research. So this is depend on the discussion or communication between universities that we have collaborations. Especially in this pandemic era, we still have the collaboration for the international research, and we got the full funding from our partner. And the setting of research is also depending on the target of project. Sometimes we can conduct it in our province, Indonesia, and some of research conducted in our partner country or area. And we can compile and combine the research that the research is conducted in Asian countries such as Malaysia, Thailand, and also Indonesia. For the implementation of research collaboration, we can do many things, not only doing the joint research, such as have the team of research in one project, not only for the funding or setting and publication, but also we can work together for joint publication. Maybe to be author, co-author. This is very, very helpful for our institution to increase the number of publications, especially to publish in the reputation journal at international level. And also we invite our partner lecturers to be reviewer in our journal and also in our academic event like conference, symposium, seminar, to review the article that we invite from the participant of the events, to be editor as well. And for the examiner, because sometimes the faculty member know that the faculty research collaboration is just for journalism and publication, but we also can involve them, I mean that our partner, to be the examiner for the bachelor program, master and doctoral program, for the external examiner, especially for their thesis or their research for our students. This is also very important. I mean that not only about the research collaboration, but also to be the examiner of the research of the student. And invite our partner to be the expert panel to develop the tools, instrument, or questionnaire, or maybe the protocol that we want to have in Indonesia, or maybe in our partner countries. So this is some of the implementation of faculty research collaboration that we have, and we also still going to develop more and many collaboration for the activity at international level. Of course, these activities will impact to our institution as well as our partner institutions. So the output is increasing of the reputation of institution. This is related to the accreditation of our institution, not only at School of Nursing, School of Medicine, at faculties, but also at the university, but also for our university. And the number of publications is also increased if we have this activity with our partner. So our lecturer can improve their activity for publications. And also this is relate an impact to the H index of the publication. And for the quality of human resource, I mean that for the lecturers, it's automatically improved by themselves if they have this and join these activities. So I mean the faculty and the university can help our lecturers to involve the faculty research collaboration and other activity at international level. Thank you very much, Sharon. That's it. That's my sharing for today. Thank you very much again.
Thank you. Thank you, Ajianto. Well, very interesting, very nice presentation about the international collaboration, especially in the research level. And I think all the presenters finish the presentation and very good time control. So I think Aaron and I, being a moderator, we feel happy because we don't need to use this bell to wake you up or to alert you. And before we close the session, we received some questions. And for you speakers, if you can go to the chat board, and I think here we have altogether 3 questions and 2 to Johannes. First one is, how, can you read here clearly? How do you evaluate if the wellness program is good or not good? What is the most important criteria from your view?
Thank you. There is excellent question from Celine. As you know that in Indonesia has a body that control of quality tourism business. We call National Accreditation Committee or CAN. I am one of member or an assessor on tourism that control of the quality of service. Actually, business on tourism as well as in wellness controlled by CAN, that how to good services are not too good. Actually start from management, SOP, Also the control of manpower. It means the certification of, for example, spa therapists should be certified. If not, cannot. That is, we give some major evidence. That is the point. But the most important criteria is certified of worker, certified of like spa therapists or other profession in the wellness. That is my question. So certified profession by we call BSNT, but certified body, national certification body, BSNT, yes, national certification body. Okay, yes. That is my answer. The second, Putih, from Putih.
Yes, let me read out because some of the audience may not be able to read because they are not in Google Meet. So the question is, wellness tourism is a new way of tourism in Indonesia. Not many people in Indonesia are aware of this tourism. My question is how government strategy to grow people awareness of wellness tourism, especially in this COVID-19 pandemic situation.
Yes, pandemic situation, it's everybody suffering as well as awareness. But for your information, Putih, that is start from 2017, Minister of Health and Minister of Tourism make it agreement to develop 10 priority destination in Indonesia to develop health and wellness tourism. It means 4 years ago, the government agreement between Minister of Health and Tourism to develop, to support of health sector support in 10 priority destination. What kind of support? It's like public health, accessibility, human development, as well as medicine and medical devices. This is government strategy. Also support about the manpower to develop every tourism university. The curriculum should be at of wellness, health and wellness tourism. It means not only the tourism as well, also wellness and health and wellness tourism should be add in the curriculum. This is the point. Actually, Indonesia is would like to make it a program. Health and wellness tourism for the future is the priority also. That is a strategy. But now the awareness is very limited because of the pandemic. Some use of webinar like this, some meeting by Google Meet, Zoom, that is strategic now to new normal for awareness. That is my point. Thank you.
Thank you, Johannes. And we have one question to Josephine. And the audience say, my question may not be related to your presentation, but maybe for your professional. What suggestions for eye prevention when all people need to use the computer every day, like we now doing all day? So please, Josephine. Yeah, please turn on the microphone, Josephine.
Sorry. Okay. As I was saying, this is a very good question, and we actually get asked a lot about this, especially now with the surge of pandemic and all learning are virtual. Kids are spending more time on the computer, and adults as well, actually. Actually, we've done some studies in the past before on usage of digital devices, how they affect visual functions. And based on our study, we have found that vision functions actually get affected within 10 minutes of smartphone usage. You might not feel it in such a short time, but we were able to measure it. Okay, so a good advice is that take frequent breaks. And there are, I would say like 5 to 10 minutes of usage if you can. You know, even if you look up away from the computer, away from your smartphone, look away for like 20 to 30 seconds, blink a lot because people get dry eyes, especially in the summer. Actually, blink rates decrease tremendously from like 20 some blinks per minute to five times per minute. So it's actually very crazy. When you're highly concentrated in doing something, you actually forget to blink. So you have to constantly remind yourself to blink. Of course, artificial tears would help if you have to be on the computer, on digital device a lot. Also, looking away for about like 30 seconds far away. Not just, I'm sure everybody has this experience. After you look at your smartphone for a while and you look away, everything becomes kind of blurry. That's because your visual function has been affected quite a bit already after prolonged looking at near. So definitely look away from your computer whenever you can. Okay, I know everybody has to work long hours, but that's one huge device or advice that I would give. And that's very important because we often forget to take breaks.
Thank you, Josephine. Thank you for your suggestion. And I think when you talk about closed eyes and everyone closed eyes and everyone follow your instructions, which is good. And we are good students. Okay. Oh, thank you, Josephine. Your information really useful. Yes, yes. Okay. So before we close this seminar, I want to invite again for 10 presenters to maybe 20 seconds to say some word or any greeting or any feeling. For example, very nervous about using this Google Meet. Please don't use Google Meet next time. Okay, we will try to use Zoom instead of Google Meet. Yeah. Okay, so may I introduce from the first speaker, Suyanto, sorry. And the next will be Grace. Please turn on the microphone.
Yeah, yes. I'm very happy. Thank you, Sharon. I'm very happy to join this meeting because this is the first time I make the conference with the Taiwan lecture. So, and also including with some researcher from across of Indonesia. Yes, I'm very happy, and I hope we can develop research together between your university with my university, especially in the medical science. Thank you.
Okay, thank you, Suyanto, and please welcome Grace.
All right, thank you. I really appreciate this opportunity, and I really appreciate Wanpei University for conducting this great webinar, and also, of course, the great presentations from other speakers. And this is really a fruitful discussion, and then I, of course, all other participants also got the useful information related to global health and international collaboration. I hope that in the next future, we can also continue this collaboration with our university, Samratulangi University, and also all other universities in Indonesia. Thank you for this opportunity.
Thank you, Grace. Pei-Fen, please.
Yeah, thank you for your invitation. It's a great webinar that we learn a lot from different presenters and really helpful for our brand, even that hurt our eyes. Then we will reminding ourselves to remember the suggestion from Josephine that also help our eyes healthier and help our brand more progress. Okay, I will look forward to the next webinar. Thank you.
Thank you, Pei-Fen. Next, Jessica, please.
Okay, thank you. I would like to say thank you for UNB University's committee. I'm so honored to become a speaker for your international webinar. I hope next time I could participate all kind of your webinar. Thank you.
Thank you, Jessica. Please welcome Professor Yi Hong Zhou.
Surely we enjoyed very much, and there is no doubt it's a great webinar. Thank you for the organizer. And actually, we hope someday, when very soon after the pandemic, we can meet each other, either in Indonesia or Taipei or Taiwan. Anyway, so close our eyes sometimes, but open our heart or mind always. Thank you.
Thank you, Professor Zhou.
Thank you.
And thank you. And Professor Johannes, please.
Thank you. It's great webinar. We would like to appreciate with UPenn University, and thank you so much that tourism part of this seminar, because health and wellness tourism, I think, is should be developed as well as Indonesia and Taiwan. Hopefully, for the next, we can cooperation more focus, more detail, and more close, and we can visit each other. That is my point. Thank you so much.
Thank you, Johannes.
Yeah, thank you.
Let's welcome Jordan.
Yeah, thank you very much. I'm so glad to be part of this seminar. It's such a great seminar, and it's a pleasure to be one of the speakers. Thank you for organizer from UNP University, and also Siska, who always contact us and also remind everything about the meeting, about rehearsal, and also this morning seminar. It's so glad to have her to be the reminder for us. We got many perspective from from many professors and also experts from Indonesia and also from Taiwan. And I think most important thing that I can get today is actually I know how to operate and share the presentations with this Google Meet. So thank you very much, and hopefully that we can have and establish many cooperations to widen our network in both domestic and also international level, especially with Taiwan. Thank you very much.
Thank you, Jordan. Please, Diane.
Hi, thank you very much. Yeah, this is really my pleasure and an honor for me. Actually, this is the first time I talk about the topic of student exchange because my background is psychology and never I talk about this topic before. But yeah, I feel when the first time you invited me and we did many rehearsals, the engagements that I feel is different. That like we touch each other by heart, as Professor Chu said. And I learned also Mandarin words from Professor Chu. Ni hao and shushu.
Ni hao.
Thank you very much. And yes, for all of the committee and also from the Yuan Bay Medical Technology University, it is really a great event. And I hope that we can connect each other, making a harmony and also peaceful life for the others and inspiring each other. Thank you very much.
Thank you, Dion. Okay, Josephine, please. More suggestion for eye prevention.
Eye prevention, huh? Well, definitely, like I said, frequent breaks. And let's see. One myth I kind of want to debunk is that people think that, you're in front of screen all the time, eventually you're going to go blind, but that's not true. You just need to take more breaks and go, if you can, go out when nobody's around and take a breath and look out far away. I think that, we all need a break from this pandemic, but, as well as the computer. But thank you for your invitation to this webinar. It's been great to hear all the speakers sharing their specialties and their knowledge, and this has been an enjoyable afternoon.
Thank you, Josephine. And Adrianto, please. And after Adrianto, I would like to invite Siska because she is very important, our representative in Indonesia. Okay, so Adrianto, please.
Yes, thank you very much. This is very great. This is very great chance for me to involve in this speaker in this international webinar. Thank you to Yanpei University of Medical Technology, especially for Siska. Thank you very much for your kind to contact me, and hopefully we can collaborate in the near future for our international activities. Even we are still in COVID-19 era, so we can still share and learn each other regarding our activity at the university level. Thank you very much.
Thank you, Adrianto. Okay, let's please welcome Siska.
Okay. I just want to say thank you to everyone, especially to all speakers from Indonesia. Thank you all for your cooperation, and sorry if I, sometimes I disturb you to remind you to send everything that we need for this webinar. Hopefully we meet again next time for the next webinar or for other cooperation. Thank you very much. Stay healthy, everyone.
Thank you, Siska. Okay, we are going to have group photos, so please look at the camera of your laptop. And okay, then please smile. Yeah. And second one is thumbs up. Okay, everyone, please thumbs up. Okay. And okay. Excellent. Okay, thank you. And we have QR code for the post-webinar survey. If my colleague can do the share screen, and I would like to invite you and also all the participants to scan this QR code, either using your mobile or just follow this QR code to fill in this survey question. And okay, finally, on behalf of organizing committee from UNPEI, I would like to express our sincere appreciation to all the speakers for their wonderful presentations and all participants from Google Meet or YouTube. And this is our first time to host such a big webinar in our university history. And we do hope you enjoy, no matter how nervous you were using the Google Meet or using the background change. And I do hope we are looking forward to have more collaboration in the future after the pandemic. And please stay healthy and happy during this pandemic situation. And I also thank you for another moderator, Aaron. Would you like to say something?
No, I just want to away from computer and bring my eyes, drink more water. And thank you very much for everybody's. I love you all. Thank you.
Thank you, and see you soon. Okay, bye.
Bye.
Bye. Thank you, everybody.
Thank you for your participation.
See you soon.
Please feel free to
See you.
adjourn. Thank you.
Bye-bye.